and welcome to this week's episode of NHIS in a Week. Here, we give you a recap of happenings in the authority as well as the scheme. My name is Bridget Appiah. The headlines. NHIS Chief Executive prioritizes staff welfare. WHO Ghana advocates sustainable financing of Ghana's healthcare system. Savannah Regional NHIS staff undergo orientation and refresher training. Now, our first story. The acting chief executive of the National Health Insurance Authority, Dr. Victor Asare Bampo, has assured staff of his unwavering commitment to improving their welfare. Addressing a maiden staff deba, Dr. Bampo unveiled new initiatives to boost motivation and productivity across the authority.
Speaking at the NHIS head office forecourt, Dr. Bampo commended staff for their dedication and underscored their crucial role in achieving the authority's goals.
I thank His Excellency the President for giving me this unique opportunity to lead such a fantastic team. I've worked in so many countries around the world, but this, for me, bar none, is the most efficient, knowledgeable, dedicated team of individuals I've worked with.
He announced plans to establish a credit union and staff welfare fund to empower employees financially.
If, for example, you need funding to do something, as we all do, there must be means by which you should be able to get the funding without spending too much time to think about it. That is why I'm sure you've heard, but you'll be hearing more about that we're setting up a credit union to ensure that when you are a member of the credit union, you can take money from it to do what you need to do. We're also setting up a welfare fund.
He acknowledged the concentration of development opportunities at the head office and pledged to decentralize access to capacity building programs. While praising the attainment of 18.6 million active members in 2024, he encouraged the workforce to double the figure by the end of 2025. Dr. Bampo emphasized the need to uphold professionalism and rebuild public confidence in the scheme. He reiterated the government's commitment to universal health coverage through the free primary healthcare and Mahama Cares policies.
We are mirroring the President's vision, which means that we are going to do whatever it takes for us to achieve Mahama Cares and free primary healthcare. And there are a lot of things that we are already doing to make sure that this is achieved. So that is the first big vision.
Moving on. The World Health Organization's Ghana office is pushing for sustainable domestic financing mechanisms to support Ghana's march towards universal health coverage. WHO officials held a working meeting with NHIS Chief Executive Dr. Victor Asare Bampo in Accra.
Dr. Frank Lulin, officer in charge at WHO Ghana, called for intensified effort to remove financial barriers to healthcare. He commended the government's free primary healthcare and Mahama Care initiatives and pledged WHO's continued support for preventive and promotive healthcare.
We had an opportunity to meet with the Honorable Minister of Health, and again it was a courtesy call, but he very clearly mentioned the priorities for the government over the next 4 years. And he was mentioning free primary healthcare initiative, Mahama Cares, and we really thought this was an opportunity for us as WHO to engage and see how we can jointly work and support where we can to really actualize the vision of government.
Dr. Luli also acknowledged Ghana's role in hosting the West African Health Organization and expressed concern over global funding cuts, especially from the US. Dr. Bampo urged government support to maintain WHO's impact.
We're going to have a high-level meeting here in Ghana led by the President, looking at how we can move from the benefactor model of getting funds from the US and others to using our own resources and supporting international organizations like yours, so that you can be here to support us. So I will be a champion on this, and we'll see where it will go.
Dr. Bampo cited the uncapping of the health insurance fund as a step in the right direction.
I think Honorable Minister spelled it all out. The President is so focused on health and making sure that we have universal health coverage. And that's why he promised that he was going to uncap and repeal the Act 947, which he has done, which means that we will have much more resources. The Minister of Finance has also promised us that he's going to make sure that he provides funding more regularly. And colleagues will tell you that now, instead of waiting the 90 days, we are going to be paying more regularly.
He reiterated NHI's commitment to eliminating illegal out-of-pocket payments and announced the reactivation of a national task force to enforce compliance. Deputy Chief Executive Dr. Jokoto expressed appreciation to WHO for its collaboration. Senior Technical Advisor Dr. Chris Etim presented a summary of the free primary healthcare policy, and directors from both organizations contributed to the discussions. The WHO delegation included Mr. Philip Kennedy Yarrow and Dr. Adjoa Chum Berema.
Damango, the Savannah Regional Office of the NHIA, has rolled out a 2-day orientation and refresher training to improve staff efficiency in monitoring and evaluation.
The training, which was held on May 13 and 14, was led by Acting Regional Director Mr. Kasimu Abdullahi and Operations Manager Mr. James Sumani Boa. The program aimed to standardize reporting and strengthen administrative capacity across the region. Participants were trained in post-credential monitoring, co-payment oversight, program of work development, and maintenance documentation. Breakout sessions facilitated by unit heads ensured role-specific upscaling. Staff were assessed and reassigned responsibilities to align with strategic goals. Many employees applauded the initiative and advocated for regular capacity building workshops to sustain service delivery excellence.
In addition, the NHI's Quality Assurance Directorate has successfully concluded its nationwide sensitization workshops on the standards for networks of practice, with the final session held in Accra.
The session, supported by the World Bank, gathered staff from all three belts, Northern, Middle and Southern, to reinforce quality standards in credentialing and monitoring. Acting Director of Quality Assurance, Dr. Lydia Anabisi, emphasized the importance of consistent evaluation between major assessments to ensure continuous healthcare improvements. She encouraged trained district staff to support facility monitoring and highlighted the role of free primary health care and Mahama Cares in improving access to health care. Mr. Eugene Segbefia, Acting Deputy Director of Credentialing, walked participants through inspection protocols and scoring methodologies. Director of Claims, Dr. Abigail Dejikwate, stressed interdepartmental collaboration, noting that teamwork is essential to achieving universal health coverage. Regional directors pledged implementation support, and participants actively engaged with the material, raising practical ideas for improving oversight and accountability.
Moving on, the NHIA Upper West Regional Office has held its first extended management meeting under Mr. Tindongo Rashid Mohammed, the newly appointed Acting Regional Director. The session marked a fresh chapter for the region's health insurance leadership.
The meeting, held on May 8th, brought together district managers and leadership to strategize on strengthening service delivery in the region. Mr. Mohammed, who joined NHIA 17 years ago, expressed gratitude for the opportunity to serve and emphasized empathetic leadership and team cohesion. He praised the region's achievement of maintaining over 80% active coverage, the highest in the country, and urged vigilance to sustain it. Managers welcomed his vision and thanked NHIA executive management for promoting talent from within. Challenges discussed included staff shortages, ID card deficit, and delays in deploying new membership tools modules. A 30% drop in active membership in Q1 2025 sparked concern, but district managers pledged corrective action to ensure a mid-year recovery. The meeting concluded with renewed determination under the theme, Driving Innovation and Impact, Re-energizing Health Insurance for Sustainable Growth Beyond UHC.
Our final story. The National Health Insurance Authority staff in the Upper West region have honored the newly appointed Acting Deputy Chief Executive in charge of Human Resource and Administration, Mr. Raphael Sekpet. The gesture celebrates his rise to executive leadership and acknowledges his contributions to the authority over the years.
Delegation from the Upper West Regional Office of the NHIA, led by Acting Regional Director Mr. Rashid Ndogo, visited the authority's head office in Accra to congratulate Mr. Raphael Sekpe on his appointment. The team presented him with a citation and a traditional smock as a symbol of their pride and appreciation, also thanking the president for elevating a native of the region to a top leadership position. Mr. Sekpe, who had risen steadily through the ranks of the NHIA, expressed heartfelt gratitude for the recognition. He pledged to uphold the president's vision, promote staff welfare, and help position the NHIA as a benchmark of public service excellence. The new Deputy CEO also assured staff of his continued dedication to the authority's mission of achieving universal health coverage and improving healthcare access nationwide.
Sincerely say I'm very humbled, and what else can I say? I'm a son of the soil, and so I appreciate the fact that if my own people acknowledge and recognize me, I think it's the highest honor you can get, because it is often said that no prophet is without honor except his home. And so for me, all along I've always believed that there's no honor there. I only do it as a duty to the motherland. But the fact that you have this thought, is humbling, motivating, and uplifting. What can I say? I can only try to do more for Ghana. And since Upper West is part of Ghana, we will all be happy. Thank you. Thank you.
I don't understand. I hope you've been taking your medication. I do better. I found. And I say, be Pedro body.
Hello, ma.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh. So you people are here to test my faith in you. Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the power of you, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes, you can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
This brings us to the end of today's episode of NHIS in a Week. For more stories, do well to visit our website www.nhi.gov.gh and do well to visit us on all our social media platforms displayed on the screen. My name is Bridget Apia. Have a lovely weekend.